Hello, I'm Dr. John Oyston, and welcome to this 30-minute video presentation about safer nicotine products for people who smoke. I spent almost 40 years in the operating room, and while I was working there, a typical patient that I would see about once a month would be someone in their 60s coming for a below-knee amputation of the leg. And as I reviewed the chart, I'd find out that this person started smoking as a teenager, tried to quit when they were 40 or 50 but failed, came to the hospital a couple of years ago for a vascular procedure, maybe an angioplasty or an in situ bypass, was told at that stage that they needed to quit smoking, but somehow they didn't manage. And now they're in my operating room about to have their leg amputated. And that seemed to me to be a huge price to pay for a stupid mistake they'd made as a teenager, and because the smoking cessation methods we have at the moment are not particularly effective. So I looked at other ways we could get people to stop smoking. I began with a campaign called Stop Smoking for Safer Surgery, because if you can get people to stop smoking 4 weeks before elective surgery, you can halve their risk of wound infections and post-op respiratory complications. And I presented this at the Ottawa Model for Smoking Cessation conference. I then looked into the idea of raising the minimum legal age for smoking tobacco to 21. And this actually ended up being passed in Prince Edward Island, but not taken up in the rest of Canada. I made the hospital I was working in smoke-free before that was a national standard. Once I retired, I took the Teach course in smoking cessation. I wrote an editorial for the Canadian Journal of Anesthesia about what anesthesiologists need to know about vaping. And I talked about vaping at conferences in Vancouver, in New York, and in Warsaw. I met up with people like Dr. Sonia Johnson, who's the Director General of the Tobacco Control Directorate for Health Canada. And throughout the whole process, I kept a blog and was active on social media with a Twitter and Instagram account and a YouTube channel. As far as conflict of interest is concerned, I'm proud of the research, the writing, and the advocacy of work I've done on these issues, but some of it was funded by the tobacco and vaping organizations. I'm not pro-vaping, but I'm anti-tobacco, and I see vaping as a way to control tobacco use. I'm not being paid by anybody to make this video. So this is my basic thesis. People who still smoke know that smoking is dangerous and they want to quit. They fail to quit because cigarettes have made them dependent on nicotine. Without nicotine, they get withdrawal symptoms and cravings that lead them back to smoking. But nicotine, separated from cigarette smoke, is a fairly harmless natural substance. And therefore, as physicians, we should be advising patients about safer sources of nicotine. The evidence I'm going to present is, first of all, that cigarette smoking is even worse than you think, and we should care about people who smoke. Vaping is a safer alternative to smoking and a way to quit, but public health and even healthcare workers are ignorant about vaping, and vaping is being unfairly vilified in Canada and the US. Whilst there are alternative safe sources of nicotine that are saving lives globally. And then I'm going to conclude by talking about how to quit smoking in 2023. So tobacco smoking kills about 8 million people a year. That's more people than malaria, violence, or tuberculosis. Even if you look at the bit in purple at the bottom left-hand corner, that's people who die from second-hand smoke. Second-hand smoke kills more people than AIDS, illicit drugs, or malaria. In fact, tobacco kills 20,000 people a day. If the airline industry was as dangerous as the tobacco industry, we'd have 30 fully laden jumbo jets crashing every day with no survivors. But there's also disease and disability as well as death. Some people die quickly with a heart attack or a stroke, but others die slowly and they suffer. They may have severe COPD and become a respiratory cripple and dependent on oxygen, or they may get cancer and require major surgery and chemotherapy. This is a quote from the partner of a lung cancer patient. I lost my long-term friend and former partner to lung cancer in December of 2020. For nearly 22 years, I witnessed as her struggle, not only with the excruciating pain of her illness, but also with the emotional and psychological toll it took on her. The shame that she felt as a smoker, unable to quit before the damage was done. And this comes from a woman who was a smoker and who's now vaping and hopes to avoid these consequences. So why should we care about people who smoke? Well, they chose to smoke, they knew the risks, and they could quit if they really want to. So maybe if they keep on smoking, they really deserve to die. Well, first of all, I don't like the word smokers. We should be calling them people who smoke. So we don't talk about the disabled anymore as if that's one big lump of people. We talk about people living with disabilities, or PWD. In the same way, I think we should talk about people who smoke. Now, this is politically correct person first usage, and you can say that I'm woke and I'm a social justice warrior. But the words that we use to describe groups of people are important. They divide people into the us, who are important, and the them, who are somehow lesser, and we shouldn't worry about them too much. And there's a sort of slippery slope. Smokers, addicts, idiots. It's easy to think of smoker as a pejorative word. Now, most people start smoking as teenagers. In fact, 90% of adults who smoke started by the age of 18. But in general, we treat people under 18 differently from adults. That's why, for example, we have the Young Offenders Act. And this is because the brain isn't fully mature until people reach the age of 25. So younger teens have spent their entire lifetime being controlled by their parents, but as they get into their older teenage years, they have more freedom, they have money, they have a place of their own, they have friends that they visit without their parents being around. And adolescence is a time to explore boundaries and to take risks. So it's not surprising that some teenagers experiment with smoking, vaping, drugs, and a whole pile of other things. And in fact, adolescence is a time to explore boundaries and take risks. Now, when we say they know the risks, do we even know the risks? So, what percentage of people who smoke die from smoking? We now think this figure is as high as 67%. 2/3 of all people who smoke regularly end up dying as a result. The CDC lists 12 cancers and 20 diseases caused by smoking. What are they? Well, to be honest, I can't remember all of them, but as well as the obvious ones, things like lung cancer and COPD, there's also more obscure things. Smoking increases the risk of liver cancer, cancer of the cervix, and acute myeloid leukemia. People who smoke are more likely to have diabetes, rheumatoid arthritis, blindness, and amputations. And finally, how many years of life are lost by smoking? Well, the average cigarette smoker ends up losing 10 years of life to cigarette smoke. They could quit if they wanted to. This is a really important issue because if people quit smoking in their 40s, they avoid almost all the risks of smoking. It seems the human body is sufficiently resilient that we can withstand 10, 20, maybe even 30 years of cigarette smoke before things start to go badly wrong. But unfortunately, the smoking cessation methods we have are really very ineffective. So if 100 people try to quit, if they use the cold turkey method, only 4 of them will quit. If they use medical nicotine replacement therapy, maybe 7 of them will quit. If they use drugs to help them quit, then that gets up to maybe 10. And if they use vaping with a nicotine-based e-cigarette, maybe 18 of them will quit, but 82 of them will still smoke. So while vaping is a good way to quit smoking, it's not a silver bullet. We need to understand that nicotine is the natural substance in tobacco plants that makes smoking enjoyable and makes it hard to quit. So nicotine is present in tomatoes, potatoes, peppers, and eggplant. It seems to be something that acts as a natural insecticide for the plants. When you use it, it creates pleasure, relaxation, and improved concentration. It helps with anxiety, depression, ADHD, and schizophrenia, and is currently being investigated as a treatment for dementia. Nicotine does not cause the cancer, the COPD, and the heart disease that comes from inhaling burnt tobacco leaves. That's why nicotine is so safe. It's sold as an over-the-counter product in Canadian pharmacies. So to summarize this, people smoke for the nicotine, but they die from the tar. However, many alternative sources of nicotine are available. This includes vaping with e-cigarettes, heated tobacco products, also called heat-not-burn devices, snus and oral nicotine pouches, and medical nicotine replacement therapy. So this is prepared by a tobacco company, so you can take it with a pinch of salt if you wish. But it's generally recognized that if you rate cigarettes as 100 on a scale of lethality. Snus, heat not burn, and vape are roughly 10% or even less of the risk of cigarettes. And nicotine replacement therapy and nicotine pouches are probably less than 1% of the risk of cigarettes. So when we talk about safer sources of nicotine, what are we looking for? Well, what we want is nicotine, because if you don't provide people with enough nicotine quickly, if you don't match the sort of profile that they get from smoking a cigarette, then it's not going to satisfy them. It's not going to prevent their withdrawal symptoms and cravings. And also, if you're looking at this as being a consumer choice, you're wanting to offer cigarette consumers an alternative product, then the alternative product has to be enjoyable. And this is why flavors are so important. What you want to avoid is combustion, because when you burn things, you create a whole group of toxic chemicals. You want to consider avoiding inhalation, because while the lungs are a very good drug delivery system, they're also very delicate, and you don't want to risk damaging them. And arguably, you should avoid tobacco, because I don't think there's any form of tobacco that is 100% safe. And whilst you have tobacco, you have a tobacco industry, and nobody really trusts the tobacco industry. So on the left here, we have a picture of a typical vape, and then next to it, you have a refillable pod, and then the USB charging cable. On the right, you have a series of e-juices or e-liquids that go inside the vape device. These contain a mixture of vegetable glycerin and propylene glycol. They almost always contain nicotine, and they almost always contain flavors. The important thing to realize is that they do not contain tobacco. Even the one on the right here, which is tobacco-flavored vape, only contains artificial tobacco flavoring. It does not contain any real tobacco. And although vape is inhaled, there is no combustion. So according to Public Health England, e-cigarettes are not risk-free, but they're far less harmful than cigarettes, and probably at least 95% less harmful. In Canada, our Associate Minister of Health has said, vaping products offer the 3.8 million Canadians who smoke a less harmful source of nicotine than tobacco products, and they do help people to stop smoking. The Centre for Addiction and Mental Health, in its lower risk nicotine use guidelines, goes on to say, e-cigarettes with nicotine may be an effective cessation aid for people who use combustible tobacco. Daily use of e-cigarettes is associated with an increase in cessation outcomes. People who switch from combustible tobacco to e-cigarettes will reduce their exposure to numerous toxicants and carcinogens, and continued use of e-cigarettes may reduce the risk of relapse to combustible tobacco. The Health Canada website says, the evidence suggests that vaping nicotine can help adults quit smoking. It says if you've tried approved methods to quit and are still smoking, switching completely to vaping nicotine is less harmful than continuing to smoke. If you look at Canada's tobacco strategy, it begins by acknowledging that 48,000 Canadians die from tobacco-related diseases every year, and it's set a target of reducing the prevalence of tobacco use from 8% to 5% by 2035. One of the ways it wants to do this is by giving people who smoke access to less harmful options that will help reduce their health risks and possibly save lives. They want to help Canadians to quit tobacco by giving them information and access to less harmful sources of nicotine. So it seems that public policy is following the science, recognizing that vaping is much less harmful than smoking and an effective way to quit. But the public, people who smoke, and even healthcare practitioners have not got that message. So in a Health Canada survey, when people were asked is vaping more or less harmful than cigarettes, 22% of people said it was more harmful, only 18% said that it was less harmful, and the remainder of people were confused or didn't have an opinion. Very importantly, only 17% of adults who smoke but don't vape understood that vaping is less harmful than smoking cigarettes. People aren't going to switch to vaping unless they understand that it's less harmful. When Health Canada did a survey of healthcare providers, they found, again, huge levels of ignorance. 56% of GPs admitted that they were not knowledgeable about vaping. 64% of nurses, 50% of pharmacists, and 39% of GPs felt that vaping nicotine was worse than smoking. And 77% of healthcare practitioners did not consider switching completely to vaping was a form of quitting smoking. Contrast this with what's happening in the UK, where vaping is the most popular way to quit, where stop smoking services report quit rates of between 60 and 74% when smokers use vaping as a way to quit. This is an extraordinarily high success rate. And there are now 2 million people who have quit smoking by switching to vaping. And the UK has doubled down on this. The NHS has now built vape stores inside hospitals, and they plan to give away 1 million vapes for free to low-income people who smoke. But in Canada and the USA, vaping is being unfairly vilified, and it's not getting a fair trial. For example, the Physicians for Smoke-Free Canada say that e-cigarettes do not help smokers quit. This is completely untrue. A Cochrane review finds that there is high certainty evidence that nicotine e-cigarettes are more effective than traditional nicotine replacement therapy in helping people to quit smoking. And Martin Dockrell, who ran the Tobacco Control Programme for Public Health England, says, "The claim that e-cigarettes can't help smokers quit is now so plainly false that anyone making it not only discredits themselves, but worse still, undermines public confidence in science." People are concerned that vaping is a gateway to smoking and that it's undoing years of progress in tobacco control. But in fact, the opposite is true. In this graph, the blue line represents smoking in US high school students. And you can see that from 2004 to 2013, there was a decline in smoking of about 1% a year. In 2013, vaping became popular. And from 2013 to 2021, the decline in smoking was 1.4% per year. So smoking rates declined more rapidly once vaping became popular. It's also important to notice that of all the people who were vaping in 2019, 27.5% of high school students, by 2021, more than half of those people had quit, suggesting that this is a fad rather than a new lifestyle. People say vaping causes cancer, and this is true to a certain extent. You can prove that there are carcinogens in vape and that they can cause cancer, but you have to have a risk assessment and you have to think about the risk of cigarettes compared to the risk of vape. And if you study this properly, you end up finding that the lifetime risk of cancer from vape is 0.4% of the risk of smoking. So from the point of view of cancer, vaping is more than 200 times safer than smoking cigarettes. Some people, like the American Lung Association, say that vaping can cause popcorn lung, which they describe as a dangerous risk of flavored e-cigarettes. So what's going on here? Well, Health Canada says vaping is not known to cause popcorn lung, and they explain. There is concern that people who vape might get popcorn lung from being exposed to diacetyl. Diacetyl is a flavoring that gives a butter-like flavor to foods and to vaping products. However, there have been no reports of popcorn lung occurring due to vaping. While diacetyl was once common in vaping products, steps have been taken to reduce its use. In case you're confused, we can look across the pond to Cancer Research UK. Does vaping cause popcorn lung? E-cigarettes don't cause the lung condition known as popcorn lung. There have been no cases of popcorn lung reported in people who use e-cigarettes, and e-cigarettes are one of the tools that can help people who smoke to quit. Some people think that vaping caused EVALI, which is a severe acute lung injury. You may remember from the second half of 2019, there were lots of horrific reports in the media of people who are often young athletes in high school or at university who suddenly developed a severe lung injury, ended up on a ventilator in ICU. Some of them died, some of them had lung transplants. It was a horrible condition. But this was an outbreak that occurred between June and December of 2019. And although it killed 68 people at that time, it's now over and there are very few ongoing cases of EVALI. It happened mostly in America. There were no Canadian deaths, and there was almost one death in England from EVALI. And it was caused by illegal THC products that were laced with vitamin E acetate. EVALI was not caused by legal nicotine vaping. And in fact, this is an example of what happens when you prohibit something. The states where THC was prohibited were the ones that had the most EVALI cases. And when you get to a situation where only criminals sell a product, then obviously there's no quality control possible and no regulation possible. If you want to know what vaping does to the lungs, perhaps this study is more helpful. Switching from smoking to vaping helps patients with COPD. They feel better, they have fewer exacerbations, they have improved pulmonary function tests, and they can walk further in 6 minutes. In fact, switching from smoking to vaping should be considered a treatment for COPD. But vaping is being held to unreasonably high standards. People complain that it's not harmless. Well, no medication is 100% safe. People die all the time from aspirin, from penicillin, from insulin. If you have a powerful medicine, it's going to have some dangers. They say we don't know the long-term side effects. Well, we don't know the long-term side effects from the COVID vaccine either. But knowing what's in the vaccine, we can predict that it's safe and that we know if we don't use it, millions of people will die. They say that no vaping products have been medically approved for smoking cessation. This lack of certification doesn't mean that vaping is dangerous or ineffective. It just means that the companies that produce vapes haven't gone to the trouble of doing the government paperwork necessary to get medical approval, which is unfortunate, but it doesn't diminish the validity of the science. Vaping is not the only safer source of nicotine. So there are other alternatives. For example, heated tobacco products, also sometimes called heat-not-burn devices, use a small stick of real tobacco, the white thing at the top of the picture. This is heated with a metal blade that goes into the tobacco, and the vapor is inhaled, but there is no combustion. So this is way safer than cigarette smoking, but probably more dangerous than vape. And it's become very popular in Japan. So after heated tobacco products were marketed in Japan, there was a 43% drop in cigarette sales. And this is validated by Japanese government taxation data. Overall, 75 billion fewer cigarettes were sold per year. The company involved says that this has reduced COPD and heart disease. I think this needs to be independently verified, but in the long run, I think it's likely to be true. There's also snus and nicotine pouches. These are small pouches that you put in your mouth between your teeth and your gum, usually on the upper jaw. And the one on the left is snus, which is also on the bottom. And this contains real tobacco, which has been purified and cleaned to make as safe as possible. The one on the right on the top is a nicotine pouch. And this does not contain any tobacco. It just contains nicotine, cellulose, and chemicals to control humidity and pH. And sometimes flavors are added. So these have no burning and no inhalation, and the nicotine pouches are also tobacco-free, making them pretty much as safe as possible. This graph shows the prevalence of cigarette smoking in European countries. Way over at the left side, you can see Sweden. The blue line for cigarette smoking in Sweden shows that the cigarette smoking rate in Sweden is half that of its next competitor, the United Kingdom, and it's roughly a quarter of the European Union average in the middle of this picture. So Swedes don't smoke very much, but the orange line shows the use of all nicotine products like snus. And you can see that the Swedes use an enormous amount of these products. And in fact, their overall use of nicotine and tobacco is higher than the European average. So what they've effectively done is they've switched from using cigarettes to using all nicotine products. So what effect has that had on their health? Well, Sweden has the lowest rate of tobacco-related mortality in Europe. It has the lowest incidence of male lung cancer, less than half of the European Union average. It also has the lowest rates of oral and pancreatic cancer in Europe. And this is important because these are cancers that were traditionally associated with other forms of oral tobacco. So you would think all the health ministers across Europe would be screaming, how can we get our people who smoke to switch to being people who use snus? But that isn't the way it's gone. Snus is actually banned in the European Union everywhere except in Sweden. The situation in Canada is that snus is available, but nicotine pouches, which are the even safer tobacco-free version of snus, are unauthorized for use in Canada. And this is very illogical. So traditional tobacco control groups tend to oppose safer nicotine products for several reasons. Firstly, they're risk averse. They expect alternatives to smoking to be harmless, which is unrealistic. They fail to compare the risks of vaping and other nicotine products to the risks of smoking, and they tend to believe in nicotine abstinence and prohibition. They're also perhaps influenced by Big Pharma, which sponsors many of their conferences and often provides free samples to their clinics. Perhaps they don't want competition because in Britain, government stop smoking clinics now have much decreased attendance because people just go to the local vape shop. And people who work in this field, their jobs depend on the existence of a tobacco and nicotine problem. In addition to this, all forms of harm reduction are usually opposed by the status quo. Nobody wants something new and different. So how should physicians treat people who smoke in 2023? There's 6 things you can recommend to them. Cold turkey is still entirely valid because it's cheap, it's free, in fact, and it doesn't require any particular help or skill or equipment. And you can try to quit cold turkey this week, and if it doesn't work, you can try next week or the week after, and hopefully each time you will learn something and eventually you will succeed. Or you can go with medical nicotine replacement therapy, which is the established and proven way of getting people to quit smoking. Or you can use vaping, nicotine pouches or snus, or medical treatments for smoking cessation like Champix or bupropion. And then finally, you can use heated tobacco products, which I would say are my least favorite choice of these. So people who still smoke after a failed quit attempt have 3 choices. They can continue to smoke, which gives them a 60% chance of dying, which isn't really a great option. They can try conventional treatment again, but there's going to be roughly a 90% failure rate for them, so that's not a great option. Or they can switch to a safer source of nicotine. So I would suggest that if you're a physician who has patients that smoke, you should refer them to a vape shop. You can use Google Maps to find out which vape shops are nearest to your hospital, and you can also use Google Maps to get reviews of them. In Toronto, there's a bunch of vape stores called 180 Smoke Vape that were actually founded by Dr. Batnagar, who's a cardiac surgeon in Mississauga. Now, you may feel uncomfortable about the idea of referring someone to a vape store, but I asked the regulatory authorities what they think about this. The College of Physicians and Surgeons of Ontario said that a physician's duty is to provide patients with accurate and impartial information about the risks and benefits of various types of treatment, including the risks and benefits of doing nothing. The patient then chooses, and they take the risks associated with that choice. The physician doesn't have to guarantee that any particular line of treatment will either be safe or effective. The Canadian Medical Protective Association went one further. It said that if a physician was aware of a possible effective treatment for a patient and failed to inform the patient about that option, then that physician could be found negligent. Physicians don't just prescribe drugs and make referrals to other healthcare professionals. They provide a wide range of information and recommendations on lifestyle choices. They can recommend particular gym classes or exercise programs. They can recommend traditional herbal medications, something maybe that's culturally relevant to an Indigenous person, or they can recommend lifestyle choices in terms of diet, in terms of eating margarine instead of butter or low-salt soups. If you do refer someone to a vape shop, then you should follow up. If they're not compliant, if they just don't go, then I suggest you get your secretary and make an appointment and say, okay, they're expecting you at 10 a.m. on Tuesday. If vaping is working, you should encourage patients to switch 100% to vaping and get rid of all their cigarettes. If they dual use, then they may end up relapsing back into cigarette smoking. So get rid of the cigarettes. And they should buy a backup vape and keep it in their car or their purse or their office so that they're never in a situation where their vape has got a flat battery or it's run out of liquid. And you should consider a long-term plan to reduce nicotine and quit vaping. But if patients have switched from smoking to vaping, you've already done over 90% of the harm reduction. Don't let a quest for perfection be the enemy of good. So the important thing is to get them stabilized on vaping and vape 100% of the time. And then once they've done that, you can contemplate the possibility of weaning them off nicotine and getting them to stop vaping. If vaping isn't working, you should check that they're getting enough nicotine. and maybe you should change the device. The bigger, more expensive devices produce a higher volume of vapor and therefore more nicotine. You could consider adding a patch, because you can use different forms of nicotine therapy at the same time. And you may want to consider nicotine pouches, snus, or heated tobacco products. So going back to my original point, people who still smoke know that smoking is dangerous and they want to quit. They failed to quit because cigarettes have made them dependent on nicotine. Without nicotine, they get withdrawal symptoms and cravings that lead them back to smoking. Nicotine, separated from cigarette smoke, is a fairly harmless natural substance, and therefore as physicians we should be advising them about safer sources of nicotine. Thank you for listening to this presentation. If you have questions or want a copy of the slide deck, you can email me. If you want more information, you can also look at my blog, or you can follow me on Twitter. Thank you very much.